Hi, welcome to my podcast, Help Me Rhonda. I'm your host, Dr. Rhonda Karg. I'm a clinical psychologist, and each episode of this podcast, I present mental health related information to you in hopes that you'll gain insight into some of your own behavior and also learn some new skills that I teach as part of this podcast that will improve your mental health. So, today I'd like to talk about repressed memories. I've received a number of questions about this in the last week and want to provide my perspective about repressed memories. And so, repressed memories is the idea that we have memories from earlier trauma in our life that we have buried in our unconscious to the extent that we're not consciously aware of the memory. It's in our unconscious, and that it is affecting us today, whether or not we're aware of it, but it's having an impact on us today. And some people think that if you have a hunch that maybe you had a sexual abuse trauma as a kid, let's say that you have a suspicion that that happened to you, then some people would say that you should go under hypnosis. Some people would say that you should go to psychotherapy and talk about it for a long period of time, and eventually you'll remember it. Other people don't even believe in repressed memories and the effect on human behavior. There are people that just don't believe in it. There are people that believe that repressed memories are actually from traumas that happened to one of our ancestors, because research has shown time and time again that exposure to trauma will affect your DNA and will affect the DNA of your offspring and their offspring. And so some say that if you have a strange reaction to a certain situation, person, place, thing, body sensation, that it means that you have a repressed memory about that, or that you have experienced a trauma earlier in your life or earlier in maybe one of your ancestors' lives, but that would explain your reaction to a situation that doesn't match the situation. Remember, I've said before that if your reaction doesn't match the situation, chances are there's an unconscious wound there that needs to be healed. So, how do I think repressed memories exist, and why do they exist, and what should one do about it if you think that you have repressed memories? So, yes, I believe that repressed memories exist. I've had repressed memories recovered. And another thing that I want to say about that is that your brain will make a repressed memory conscious to you. You will be aware of this repressed memory when your brain is prepared for it. So this was a trauma that happened to me when I was a young child of the age of 4. And I had an idea that something happened with this certain individual, but I didn't have any memories of it and just kind of left it alone. And then one day I was out eating with my best friend and her mother, and the repressed memory came back to me, and I cried for a minute or two because I felt a great sense of sadness for that younger version of me that had experienced that trauma, and I felt a sense of relief because I had suspected for a long time that something was there, and it turns out there was. And then my third thought was, I am going to be so angry if this screws up and ruins my love of Greek food, because this person's family was Greek, the perpetrator's family was Greek. So the good news is it did not mess up my love of Greek food at all. But that was the extent of the impact it had on me. It was like, okay, right. I knew that it was there. You'll probably feel some sadness. You might feel anger. You might need to seek out support from people that have earned your trust, or a psychotherapist, or, other individuals that can support you when you have a memory of a repressed event that happened in your life. It can bring up a lot of really strong feelings or not. If it does bring up strong feelings, just understand that that's a normal reaction to finding out that you were exposed to a traumatic event or series of events. That's a really horrible realization to have. And so I would encourage you, if that happens to you, that you do seek out the assistance of a professional, a mental health professional, such as myself, a clinical psychologist, or another person who's trained in treating trauma specifically, and work through that. And there's a variety of different tools that can help you deal with the trauma if there is a trauma that's there. And I'm going to talk about the treatments for trauma in my next video. But understand that there's help if there is a traumatic event that's there. There's help, and there's things that you can do about it to heal and even thrive in the face of adversity. Okay, it doesn't mean that you're damaged or broken, that you are somehow not whole and complete just as you are, because that's not true. You are whole and complete as you are, and you're working on things. Those are not two mutually exclusive ideas, okay? You can be whole and complete just as you are and working on things. Like I've said to people, when I stop working on myself, I'm in a lot of trouble. Because it means that I'm not aware of how I'm impacting the rest of the people around me, or ways that I can improve myself. I always want to work on myself. So, but that doesn't mean that I'm not whole and complete just as I am, because I am, and so are you. Okay, so there is help if you do have a repressed memory come back to you. Okay, now another perspective on repressed memories that I subscribe to is the idea that you can have reactions to certain stimuli based on trauma that happened to your parents, or your parents' parents, or someone in your ancestry, and it changed their DNA. Again, we know that trauma affects generations of people. And so let's say that you have an ancestor that experienced childhood sexual abuse. You you might have very strong reactions to anything that reminds you of childhood sexual abuse, even though you yourself may not have experienced that trauma. You might have that reaction simply because your DNA was changed by one of your ancestors, parents, grandparents, someone in the past. Okay, I believe in that. That's also a controversial perspective on things, but there is research that shows that trauma affects DNA in a way that is passed on from generation to generation, and I believe in that too. Okay. Now, the third perspective is about, what do you do if you believe that you have a repressed memory? What should you do about it? Some people would recommend that you go see a psychotherapist and talk about it until you remember it. That could actually lead to false memories depending on the psychotherapist that you're working with. So be very careful about that. Be careful who you talk to, because some of us are highly suggestible, and by suggesting that something like childhood sexual abuse happened when it didn't, can have a lot of damage on someone as well. So I don't do that. I don't interpret what is happening. I allow repressed memories to just come out when they're ready to come out. When your psyche is prepared for them to come out. And again, the range of reactions from a repressed memory could be something as simple as, I hope this doesn't ruin my love of Greek food, to, extreme sadness, extreme dissociation, anger, having a really hard time functioning. There's a wide range of reactions. It's on the continuum of how you will react. Now, some people believe that if there's a lot of their childhood that they don't remember, they believe that there must be trauma there. That is not true. A lot of people that have no trauma don't remember their childhood or chunks of their childhood. That does not mean that you have necessarily have repressed memories. That's just normal decay in memory over time with a growing brain. Okay, and lots of information and things to remember since then. You can forget the things that happened to you earlier in your life. Okay, so try not to jump to the conclusion that you have a repressed memory if you don't have memories of a lot of your childhood, because again, that happens to a lot of people that didn't experience trauma. Okay, so there is my take on repressed memories and what to do about them. And until a repressed memory becomes aware to you, I recommend that you just let it surface naturally when you're ready for it. I don't recommend hypnosis. I don't recommend going to a psychotherapist and talking about it, because your brain is wired to fill in gaps. And if it's something that you don't remember, your brain will want to put something in those memories or in those gaps of time. And that's just a defense. It's a shortcut that the brain, a schema that a brain can try to fill in the blanks in the absence of other information. Okay, and like I said, some people are highly suggestible, meaning that if someone suggests to them that they were sexually abused when they weren't, they could have a reaction, a trauma-based reaction to that, just because someone suggested that it might have happened. People can inadvertently coach you into believing that things happened when it didn't. Or maybe you have a memory that was generational or multi-generational, okay, or intergenerational. You could have a reaction because of that. But just be careful about trying to uncover it before you're ready. Like I said, I like these things to come out naturally when you're ready for it. I believe that trying to get them to come out too soon when your brain is not ready for it can cause harm. I believe that the brain is the most incredible organ, and that it does things to protect us, including not remembering things that were traumatic. And if that happened, let them sit, and if they're there, it will it will probably come to you and you'll remember it eventually. And there's other methods, some other creators on YouTube that suggest things like plant medicine. I do believe that plant medicine can be used to heal trauma. Uh, the MDMA just got through the last clinical trial of for treatment of PTSD, and that's been approved. And so, and then there's also something known as stellate ganglion block, which is another treatment of PTSD that involves a 10-minute medical procedure where they do a block in your neck. And people report, and research shows that people with severe debilitating PTSD can walk away from a 10-minute medical procedure like that with very few PTSD symptoms, if any. All right. And there's something known as accelerated resolution therapy, which is based on EMDR, which is eye movement desensitization and reprocessing, which EMDR is one of the most researched psychotherapy techniques that we have out there. Very effective, usually pretty quickly. So EMDR is a modality that I use for treating trauma, and a hybrid of EMDR is known as accelerated resolution therapy. That can be also very effective at clearing trauma in such a way that not that we are erasing the memory of what happened, but we are erasing the emotional charge that you have when you think of that event or that situation or that physical feeling or whatever that triggers you. Your reaction to it basically gets erased and washed away, usually within 1 to 3 sessions of ART or accelerated resolution therapy. So I want you to know that if you've had repressed memories resurface, there is help out there for you. Scientifically based, evidence-based practices to help you with your PTSD and reducing the symptoms if you have them. But know that those repressed memories will become conscious, and you'll be aware of them when you're ready for them to be. And I would highly suggest that you not try to force it, because you may have a much harder time dealing with it than you would if you were in a better place. Okay? So that's my take on it. Thanks so much for tuning in today. As I said, I'm going to have another podcast on different kinds of treatment for PTSD. I mentioned them today, but I'm going to do an entirely different podcast on treating PTSD and treating trauma. Thanks so much for tuning in. I hope that you enjoy the rest of your day.